Hi, my name is Lillian Smith, and the field that I chose to shadow was prosthetics. I chose this field because there are a lot of unanswered questions about the field, and I wanted to see what those questions were. For my project, I shadowed at 3 different places. The first place was Hanger Prosthetics, where I followed Abby Hinson, who was one of the main designers of prosthetic limbs at this clinic. This is where I witnessed the process of how the limbs are actually made. The next place I shadowed was Geriatric Physical Therapy in Bel Air with Sarah Harrison, one of the leading physical therapists at this clinic. Here is where I observed patients with lower limb injuries rehabilitate through different strength exercises. Many of the exercises are also used with new amputees. Lastly, I shadowed Michelle Yaman at the Aberdeen Geriatric Physical Therapy Clinic. This is where I observed how an amputee learns to use their prosthetic and build confidence within themselves to be able to go throughout their daily lives without any problems. Now, the woman next door is actually a patient I observed. She had trouble controlling her prosthetic and had to relearn how to walk again. After observing all these professionals, I noticed that many of the problems that the patients were suffering were caused by the uncomfortable liners that they used to cushion between the residual limb and the prosthetic. The friction causes skin irritations and tissue deformities that can cause more damage if left untreated. But to do that, one would need to take a break from using the prosthetic, which creates more of a hassle when trying to go through their daily lives and routines. To solve this problem, I have come up with a type of patch that will heal and protect parts of the residual limb that have unhealed wounds. The patch will prevent friction by creating a barrier between their skin and the liner. Looking back on the past 4 years while being in the Biomedical Sciences program here at Bel Air, it has broadened my view on the world of biomedical sciences in general, especially during the duration of this Capstone project, but mostly the engineering part. With this in mind, in the fall I will be attending Penn State University, University Park, with an intended major in biomedical engineering and a minor in biology.